I got interested in epidemiology because I began working in a local health department and I really saw the impacts you could make with that degree.
The core of epidemiology is more about the methods of how you collect data, how do you develop and design studies, how do you do interventions, and then how do you analyze those data?
In the classroom, the epidemiology department focuses a lot on bringing real-life skills into the classroom content.
We don't develop methods in abstract here, so we're really people that are working and developing and using these kind of methods are doing it in an area like cancer epidemiology or social epidemiology.
You not only learn what technologies go into tracing an outbreak, but you get to practice the technologies.
Our students are 100% part of our research team. They bring in new questions, they bring in new ideas, they bring in things in the classroom that we might not be as familiar with.
So one of the great things about our department is that we actually have multiple programs involving lab components. One such component is the lab classes that we run here on the 6th floor, which can support up to 14 students at a time. We have equipment and technologies that can look at the single cell molecular level all the way through to communities of microorganisms.
We have a lot of resources for our students and our staff and our faculty to actually do primary data collection. So we have this wonderful clinic here within our building where we bring our participants in here. We collect that data here. It's a living lab, so our students can really interact and engage in that process.
We teach you how to use statistical software. We teach you how to use laboratory techniques if you're interested in learning more about that. We teach you how to write grant proposals, how to write papers, how to write policy relevant papers, all of that type of thing.
We have a large MPH master's program that ranges from anywhere from 170 to 200 students at any given time, and a PhD program that has anywhere from 55 to 60 students at any given time. Our faculty to student ratio is quite good.
Other schools were just like, you just go to class and the professors kind of maybe know who you are, but not really. Here I feel like you're working with your professors. Your professors, they serve as your mentors as well as your peers.
When you're in classes with them, you don't realize that they really are experts that are well known in the field. Like, they're very encouraging, and they really do want you to just love and understand epidemiology with them.
Our faculty come from a wide range of disciplines, ranging from ones that are more clinical to ones that are dealing in more basic science. Others coming from social science areas, and still others coming from more ecology backgrounds, and others from mathematical backgrounds, statistics backgrounds.
There's such an open door policy here that people are very receptive to helping students. So it makes it very easy just to go get help, get assistance, or just to, chat.
Internship is really where you're kind of learning why you're studying all this.
For my internship, I worked with faculty here and over at the health system, and we were recruiting individuals for a study on oral HPV infection and how that might be related to head and neck cancers.
I was at the CDC over the summer in the National Center for Injury Prevention and Control in the Division of Unintentional Injury Prevention, working on prescription drug overdose.
The University of Michigan School of Public Health has almost 90 global public health faculty working in over 70 countries around the world.
The Global Health Epi program is mostly just about students who are interested in looking at public health in more of a global view of it.
Epidemiology students in the international setting are often involved in assisting countries with the analysis of their data and translating that data into programmatic interventions.
This summer I did my internship in Santiago, Chile. I worked at the Institute of Nutrition and Technology of Foods in Santiago.
I was working at a reconstructive surgical hospital for patients that were injured during conflicts in Iraq, Syria, Yemen, and Jordan.
During the summer of 2015, I did my internship in Blantyre, Malawi, looking and studying malaria.
Those programmatic interventions cover the entire spectrum of epidemiology, from the social determinants of health to injury, mental health, infectious diseases, and chronic diseases.
The one thing that really sets this department apart from others that I saw was that it really has that sense of community. It just makes you feel like you're part of something bigger.
A student who gets an epidemiology degree can use it in a lot of different ways. About a quarter of the students we see go into pre-med or another PhD program, but the 3/4 go on into employment. And what we see where they're going into research and academia. They're also going into hospital systems as an infection control specialist, and they're also working at health departments such as federal government, like at the CDC. They're going into state health departments and into local public health departments.
But I think Michigan has prepared me for any place that I want to go. I think that they've given me a foundation in terms of knowledge, but also in terms of the ability to build on knowledge.
Now that I'm getting ready for the job market and figuring out what I'm going to do after graduation, I feel like I have a lot of skills that I can bring to a new job.
I've loved my time here. I'm going to be sad to be graduating in April, but also excited for the future. But I think choosing this school and the university was the best decision academically that I've ever made.